Thank you so much, Kendall. So we're going to start off by talking a little bit about Medicare and Social Security. And I wanted to briefly go over the agenda. So we'll certainly talk about how Social Security works, how to qualify for Social Security. We'll then dive into a little bit of the benefits for some qualified members. So who's eligible for Social Security within special criteria. And then we'll dive a little bit on the taxation of Social Security, which is a little bit of a misconception on how Social Security is exactly taxed. Then we'll certainly review what Medicare is, how to enroll, the different parts of Medicare, the different segments that come to it, and some nuances, and also obviously the calendar as far as when to sign up, some of the consequences of not. And then we'll wrap it up with some drug coverage piece of Medicare. And then we'll be happy to open up some Q&A. So I would say throughout the presentation, feel free to use the chat feature or the Q&A feature, and certainly plug in questions there. We'll try to answer them throughout the presentation, but if we don't get to them, we'll be sure to address them at the very end. So to roll into it, on the Social Security piece, how does somebody qualify for Social Security? Well, if you've always noticed from your paychecks, you'll see that little funny line that says FICA. So everybody's essentially contributing to Social Security. And as long as you've been contributing for 10 years or 40 credits, each year counts as 4 credits, you'll qualify for Social Security. And how the question that I tend to get asked a lot is, how do they determine the amount of Social Security I will receive on a monthly basis? That's based off of your primary insurance amount. So throughout your working history, what the Social Security office does is they look at your 35 highest paid years. So they'll go through your working years, and let's say you've been working for 40 years. They'll look at the 35 of those highest paid years for those 40 years, and then they'll come up with a calculate an average of what your monthly benefit will be. That's considered your primary insurance amount. And this is something I'll cover throughout the next few slides, but collecting early or later can certainly affect how much your primary insurance amount is or how much your monthly payments will be. So for those of you who don't know, your full retirement age, which is a little bit of a misconception, it doesn't mean you have to retire at that age. For Social Security purposes, what full retirement age means is the age that you'll qualify to collect your Social Security without any reductions. So I put a little bit of a chart here, and it's based off of your year. So for those folks that were born prior to 1954, your full retirement age is when is 66. So 66 is the age you'll be able to collect Social Security without any reduction. And for those of you on the call that were born after the year 1960, your full retirement age is age 67. And anybody in between, you can certainly correspond your birth year with the program month. So for those folks that may be born in 1957, your full retirement age is 66 and 6 months. So that's when you'll be able to collect Social Security without any reductions. And I would encourage folks that have not done so yet, go visit socialsecurity.gov, set up an account there, and you'll be able to pull your Social Security statement that will tell you exactly the amount that you will receive. So the one thing I mentioned, depending on when you're collecting Social Security, you might get a reduction in benefits or you could get an increase in benefits. So the earliest that someone can collect Social Security is at age 62. And so if you're collecting it at age 62, your primary insurance amount or the monthly benefit you're receiving will be reduced drastically. So I put an example here for somebody whose full retirement age for Social Security is age 67, but they decide to collect it at age 62, so 5 years earlier, their benefit is going to be reduced by 30%. So at age 67, it would be roughly $2,400 a month they would have received, but by collecting it 60 months earlier, it will reduce it to $1,680. And that reduction is irrevocable, so it won't change. So as soon as you start collecting Social Security, that's the amount that you'll receive, and you won't get any increases from there other than cost of living adjustments. On the flip side, for those of you that decide to delay collecting Social Security, so let's say you're going past your full retirement age, your benefit will increase 8% for every year that you're delaying collecting Social Security. So if you're, in the example I've used here, if your full retirement age is 66 and you decide to delay it to the maximum delaying period, which is age 70, so there's no benefit for delaying it past 70, So if you delay from 66 to 70, every year you're delaying it, you're getting an 8% increase in benefits. So instead of getting $2,400 a month, at age 70, you'll see that it grew a little bit over $3,000 a month. So now you're looking at a 32% increase. So collecting Social Security, it's not what I would say, a clear-cut answer for everyone. Depending on your situation, some may have to wait until full retirement age. Some may benefit them to wait till a little bit further in retirement, past their full retirement age as far as Social Security goes. It all depends on the actual person and their situation. And it's certainly something I would encourage you to work with your financial professional with. One of the other questions I typically get asked is, can you go back one slide, Nicole? So if you're still working and collecting Social Security, and you're collecting it earlier, so before your full retirement age, for every dollar you earn, I'd say every $2 you earn, your benefits are going to be reduced by $1. So for example, if somebody is 65 and their full retirement age is 67, and they're already collecting Social Security and working, their Social Security benefit will be reduced $1 for every $2 they earn until they get to their full retirement age. And if you're in the year that you're to be turning your full retirement age, your benefit then drops $1 for every $3 you earn. So if my full retirement age is 67 and I'm turning 67 this year, and I'm collecting Social Security and working, my benefit will be reduced $1 for every $3 I'm earning. Is there any amount you can earn before they deduct your money from your Social Security? And there is not an amount. It's realistically based off of your age and when you're collecting Social Security. So if you're collecting it prior to your full retirement age and working, know that you're going to get a reduction. As long as you're your full retirement age and also collecting Social Security and working, there won't be a reduction. So if you're, let's say, 70 and working and collecting Social Security, they're not going to reduce your benefit. It's just if you collect any time prior. So some qualifying benefits here for anybody that is 62 or older. So at age 62 is when you qualify for Social Security. If you have a spouse who's collecting Social Security and their benefit is at least 50% more than what yours will be, know that you're entitled to half of their benefit. So if there's a working spouse and let's say their Social Security is $2,000 a month and the other spouse, their full Social Security is $500 a month, they'll be eligible to collect 100% of theirs, which is $500, or the higher of 50% of their spouses, which in this case would be $1,000. So the nuance there, though, is that the primary spouse that's collecting Social Security, the higher benefit, they have to be collecting it. So there were some rules that got clarified by the IRS a few years back. And the working spouse, or I should say the spouse that's collecting Social Security, they have to actually be collecting it for the spousal benefits to kick in. For some folks that may have been divorced, you can collect Social Security based off of your ex-spouse's primary benefit amount. The criteria here is that you've had to have been married at least 10 years, not been remarried and divorced for at least 2 years. So for some spouses out there that are divorced, as long as you're not married and you've been divorced for 2 years, you can start collecting benefits on your ex-spouse's insurance or Social Security amount. Some of the survivorship benefits as well, and Nicole can certainly dive a little bit into this on the Medicare side, but on the Social Security front, if you're a surviving spouse, so you've an unfortunate tragedy and your spouse passed away, that's an exception where Social Security will let you collect the benefit based on it being age 60. So the earliest for most folks, without an exception, is 62. But if you're a surviving spouse, you can start collecting it at age 60. The same thing is if you're a divorced spouse and the primary insurance amount that spouse passed away, you can start collecting that at age 60. And then a few other examples here. If you're a surviving spouse and you're caring for a deceased child and they're under the age of 16 or have a disability, then there'll be some benefits for that qualifying child as well. So there are some nuances that you'll have to qualify for. but here's just a handful of the examples that tend to come up for the primary reason why some folks might receive survivorship benefits. And then the last area here that I wanted to cover was going to be the taxation of Social Security. So some folks think that Social Security is not taxable. Some think that it's only taxed at a certain percentage and that's it. So the Social Security that you receive is taxable, and it's based off of your provisional income. So the formula for that is the IRS, they take your adjusted gross income, they'll add back in any non-taxable interest. So non-taxable interest could be interest received from treasuries or municipal bonds. Those get added back into the calculation. And then they look at half of your Social Security benefit, and then that's what they come up with, your combined income. So for somebody that's a single taxpayer, if your income falls between $25,000 to $34,000, then only up to 50% of your benefits are taxable. So if you're making, let's say, $25,000 a year, and your Social Security benefit is $1,000, only $500 of that $1,000 will be taxable to you. And then if you're making more than $34,000, then 85% of your benefit is taxable. Doesn't mean you're paying taxes on 85% of the whole balance, because that's sometimes what I get as feedback as well. So I have to pay an 85% tax rate. No, just it's the portion of the income that's taxable. So in this example, if you're making over $34,000 and your Social Security benefit is $1,000, only $850 of that is going to be counted as income. And then the numbers below are for the joint tax filers. So for folks that are making between $32,000 to $44,000, it goes up from the single filer, and then from 44 upwards from there, it's 85% of the benefits are taxable to you. So prior to transitioning over to the Medicare piece, I see a few questions coming in, and I wanted to address a few of them. So let me start with one here that came in. So one thing I saw here, if you collect Social Security and continue to work, does your Social Security payment continue to increase until such time as you retire? So the answer to that is no. What happens is anytime you collect Social Security, whatever age you are, that is the primary amount you will receive. From there, it doesn't, the income that you earn after that won't increase or affect the Social Security piece from that perspective. So that's why it's better to obviously plan accordingly, because some of the rules and Nicole will cover on the Medicare piece, it's very important to know some of these rules initially when you start collecting Social Security or signing up for Medicare, because a lot of it is irrevocable. You can't really change it after the fact. So one of the questions that I received here is, when determining your highest earning years, is the present value of your highest earning years used? So I'm assuming what that essentially asking is, if you're working today, is today's or this tax year income used? And it is used from those perspectives. So any year that you work past the 35 years, so because they look at your 35 highest paid years, so if you work 37 years, 2 of your lower income years will be replaced by 2 of your higher ones. So you're always going to get the benefit of your highest paid years, including the year that you're working. So I'll do one more question here, and then we'll transition over to Nicole. And I promise that we'll make sure that we address a lot of these questions at the end as well. And the question I have here is, does 401k distributions impact Social Security distributions? So this question is saying, if I start at age 62 and I draw $100,000 from my 401k plan, is that going to affect my Social Security? That level won't, because it's not a W-2 income where you're consistently working. But by collecting at age 62, you're collecting prior to your full retirement age, because your full retirement age falls between 66 and 67. So anytime you collect prior to that, you're going to get a reduction in benefits from that perspective. So it would impact it from that manner, but the income portion would not. So I'll transition over here to Nicole, who's going to dive a little bit on the Medicare aspect. So Nicole, all yours.
Thank you, Ara. Hi, everyone. Good afternoon. Today, we'll do a basic overview of how Medicare works and some of the rules that you should be aware of when you're transitioning to Medicare. So first, what is Medicare and who is eligible? Medicare is health insurance offered by the federal government that was signed into law in 1965. And the purpose of Medicare is to provide health insurance coverage to eligible people over age 65, as well as those of any age with a disability or certain illnesses. The most popular group of folks that are eligible for Medicare are those in pie piece number 1 here, and they are over age 65 and also eligible for Social Security. The other 3 groups of folks who are eligible for Medicare are those of any age with ALS or Lou Gehrig's disease, those with end-stage renal disease, which is kidneys, and those who are permanently disabled and have been receiving disability benefits for at least 2 years. Keep in mind that there is a difference between Medicare and Medicaid. Medicaid is state-offered health insurance for those below federal poverty guidelines. Here in Massachusetts, we call that Mass Health. Medicare is a federal program and it's offered to all eligible residents regardless of their income. When can I enroll? So there are 3 periods where folks can enroll in Medicare. First is during the initial enrollment period, also known as your IEP. This is when one first becomes eligible for Medicare. The IEP is marked by the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. Or if you're disabled, you're eligible to enroll in the 25th month following disability. Medicare coverage becomes effective on the first day of the month following your eligibility. If one does not enroll in the IEP, they become what is called a late entrant, where they either need to have a special life-changing circumstance or they need to wait for this general enrollment period down here, which we'll talk about in a second. The special enrollment period, also known as the SEP, is most common for people who work past the age of 65 and continue to stay on their employer's group coverage, so they don't need to sign up for Medicare right away. This is a pretty common time to sign up for Medicare, as many folks are now working past the age of 65. For a SEP, special paperwork is required to enroll in Medicare in order to protect someone from a lifelong late entrant penalty. In a SEP, Medicare coverage begins on the first of the month following the loss of coverage. And then down at the bottom, the third circumstance of when one can enroll is during the general enrollment period, known as the GEP. Folks who enroll during this period have either missed their IEP or they don't qualify for an SEP. So the GEP runs each year from January 1st through March 31st for a July 1st coverage effective date. Late entrants during the GEP who cannot show continuation of credible coverage, maybe from a previous employment, will be subject to a lifelong late enrollment penalty. And that penalty is equal to 10% of their Part B premium times the number of years that they delayed enrolling in Medicare. So for instance, if someone delayed enrolling in Part B for 2 years and they don't qualify for a SEP, they're facing a 20% lifelong late enrollment penalty to their Part B premium. Am I required to enroll in Medicare? The short answer to that is it depends. In order to avoid late entrant penalties, those age 65 and over must enroll in Medicare in the following 2 situations. First is upon retirement. And second, if one works for an employer that has less than 20 total employees and the medical plan carrier requires it. Keep in mind that this is at the discretion of the carrier. So not all carriers require members to move to Medicare when they first become eligible. As an example, when we're looking at carriers inside of Massachusetts, Blue Cross Blue Shield of Massachusetts does require members to move to Medicare if the group has less than 20 total employees. But for instance, Harvard Pilgrim Healthcare does not. However, one is not required to enroll in Medicare if they remain eligible for their employer's active health insurance and the employer has more than 20 total employees. So I just want to repeat that, as most of us now work past the age of 65. If you work for an employer that has more than 20 total employees and you're still eligible for and enrolled in your employer's active health insurance coverage, you're not required to sign up for Medicare and you will not be penalized for not signing up for Medicare. However, some folks like to sign up for Part A regardless because there's no premium for Part A. So as long as they've paid their 40 quarters of Medicare taxes, Part A does not have a premium, and it could still help with some of the out-of-pocket costs for inpatient hospital care from secondary coverage. So again, no harm in signing up for Part A. Just make sure you don't sign up for Part B, as premiums will be assessed for Part B, and there's often not enough value to Part B coverage when you already have your employer group coverage. All right, so next we're going to do a quick overview of the parts of Medicare, and then we're going to take a deeper dive into each part individually. So there are 4 parts to Medicare coverage: A, B, C, and D. And in order to have full comprehensive coverage, one would need to enroll in all 4 parts. So starting out with Medicare Part A. Part A is original Medicare provided by the federal government, and it covers a portion of inpatient hospital and skilled nursing care. Next is Part B. Part B is also original Medicare provided by the federal government, and it covers a portion of outpatient medical care. Next is Part C. Part C is offered by a private carrier. Part C comes in the form of a supplement plan or advantage plan, and we're going to go through the differences of those shortly, but the main purpose of Part C plans is to fill in the coverage gaps of Parts A and B. And then finally, we have Part D. Part D is prescription drug coverage, and it's also offered by a private carrier.
I'm getting a few in from Social Security, so I'll cover some of these here. One of them I received was, my ex-spouse is deceased. Is there any chance I can collect? So you would be able to collect under your ex-spouse's benefit amount, and you would be able to now step into 100% of their Social Security benefit, or you would be able to receive 100% of yours, whichever one is more. So you can never get both, but if you were married and you had a spouse pass away, you can certainly collect their benefit amount. The caveat here is, if you're collecting their benefit amount prior to you being your full retirement age, then there will be a reduction. Is the income noted included distribution from IRA account? Yes, anything from your IRA account does count as income, and it would be taxable to you, and it would also increase your tax portions, which would obviously go into the distribution portion of it, which I will certainly address some of the areas in Medicare as well, but distributions from your IRA or anything that counts as income does impact your Medicare as well. We'll certainly cover that in the next couple of slides.
Thanks, Hara. Sorry about that, everyone. So now we're going to dig a little bit further into each part of Medicare, and we're going to start out with Part A. So as I mentioned, Part A is original Medicare offered by the federal government. That's your red, white, and blue card right here. There is no premium for Part A, assuming that you've paid your 40 quarters of Medicare taxes. Part A provides inpatient hospital and skilled nursing coverage, and that's either in a facility or at home. Part A does have an upfront deductible. However, if you're enrolled in a Part C plan, that Part C plan will usually cover the deductible. But if you're not enrolled in Part C, the deductible is $1,600 in 2023. After the deductible is satisfied, Part A also charges daily copays. However, if one is enrolled in a Part C plan, the plan will cover either all or most of those copays for you. It's important to note down here at the bottom that Medicare Part A and Medicare Part C together do not cover beneficiaries for all 365 days of the year when they have inpatient care. Beneficiaries are only covered for 90 consecutive days per calendar year in a general hospital and 100 consecutive days per calendar year for skilled nursing care. We recommend that beneficiaries work with a financial planner as well as an estate attorney to prepare for the possibility of facing these coverage gaps. Ara, is there anything that you wanted to add to that?
Yeah, and I would say this is another area which is a little bit misunderstood by folks. So Medicare does not cover long-term care insurance. So if you've had family members, parents, grandparents that have had to go to nursing homes or skilled nursing care, Medicare does not cover any of those. What Medicare does is they cover for the first 100 days, but after those 100 days are exhausted, anything outside of that is covered privately. So it's better to plan for long-term care insurance and things of that nature much earlier on, obviously prior to needing it. But that was one area that we kind of see a lot from, I would say, the public. A lot of folks tend to think that Medicare covers everything. Long-term care is a big exception. And I would say for those of you on the call who unfortunately deal with it through as themselves, a family member, it's very costly and it's very expensive. So certainly addressing that would be fortunate for everyone.
All right, so moving on to Medicare Part B. So as I mentioned, Part B is original Medicare offered by the federal government, also your red, white, and blue card. Part B does have a monthly premium, unlike Part A, which has no premium. And we're going to review what that premium is in 2023 on the next slide. Part B covers a portion of your outpatient medical care. And this is going to be things like office visits, labs and imaging, emergency room, ambulance, medical equipment, anything that doesn't take place inpatient or is a medication, it's covered under Part B. Part B does have an annual deductible. In 2023, the deductible is $226. Depending on the Part C plan that you choose, this deductible may be covered. After the deductible is satisfied, Part B covers 80% of outpatient medical claims, and then the remaining 20% gets covered by the Part C plan, which we're going to talk about in a few.
I see some questions coming in, Nicole, on Medicare. So one of the questions is there a yearly money cap for Medicare? We'll certainly cover that portion. There is no, I would say, limit for Medicare, but it's depending on your income levels, the premiums that you're paying will be affected, but we'll certainly be addressing that in the next couple of slides.
So this is the 2023 Part B premium chart. Part B premiums are determined by your tax return filings. CMS, which is the Centers for Medicaid and Medicare Services, will look at your tax return from 2 years prior to determine your Part B premium. So for your 2023 Part B premium, they're going to pull your 2021 tax return. This is automatic. You don't have to give them your tax return. They're going to pull it right from the IRS database. And the number that they're looking for is the MAGI, or the Modified Adjusted Gross Income. That's normally line 11 of your Form 1040 on your tax return. And this is the amount that they use to determine the Part B premium. So the base premium in 2023 is $164 a month. Then as your MAGI increases, they start to incorporate what's called an income-related monthly adjustment amount, otherwise known as an IRMA, and that starts to tabulate as your income increases. So the range that your Part B premium can be in 2023 is anywhere between $164.90 per month, all the way up to $560.50 per month. And I do want to note that this is per person. Married couples are not assessed a couple's premium. Everybody gets their own individual premium.
Yeah, and I would say a few points to add here. And this kind of goes in line with the last question that we received as far as the income goes. So it's very important to be mindful of the different accounts that you have, whether it's investment accounts, retirement accounts, because anything that counts as earned income will certainly raise your income level. So I work with a lot of clients that say, and I'm looking at the first line, for example, all right, you know what, I'm retired, I'm not, my W-2 went away, I'm not making any money, so I should always be paying the lowest level. Social Security counts as income. If you have rental property anywhere, it counts as income. Distributions from 401k plans and your IRAs, the pre-tax accounts, they count as income. So you want to be very mindful of being diversified, not just obviously on the investment side, but the different accounts that you have. So we're big proponents here of Roth accounts, Roth IRAs, or adding to Roth 401k plans. Anything that does not count as income, we certainly like for a variety of reasons, including Medicare means testing, which is essentially the more you make, the more you're going to pay for your Medicare premiums. And as most of us experience, that the government is great about adjusting things periodically. So over time, you can certainly imagine that these haven't stayed stagnant. Premiums tend to go up per each category regardless. So it's always good to be as flexible as possible. So I just wanted everyone to be kind of mindful of, just because you're not working anymore and you're retired, does not necessarily mean your earned income tends to be lower. For a lot of clients, depending on Social Security and the different retirement accounts they have, their incomes could very well be the same, if not more, depending on the particular year. So I'll answer a few questions that are coming in while this is flowing. Does Social Security payment count as income? It does count as income, a portion of it, so half of it would count as income when they're going through your when you're going through your modified adjusted amount.
So next we're moving on to Part C. So again, Part C is offered by a private carrier, and its purpose is to help with the out-of-pocket costs that Parts A and B don't cover. Part C plans do have a monthly premium, and depending on the plan chosen, there may still be some out-of-pocket costs for your care in the form of deductibles and copays. However, Part C plans do cover the bulk of patient charges that are not covered by Parts A and B. So Part C plans come in two forms, Medicare Supplement and Medicare Advantage. And on the next slide, we're going to go through the differences between the two, but the major difference on how each plan operates is that Medicare Supplement is just that, it's a supplement. It helps to fill in the coverage gaps of Parts A and B, whereas Advantage plans work a little bit differently in that they're a whole separate plan. They replace Parts A and B altogether with a full plan from the carrier. And just a reminder that just like Part A, Part C plans do not cover patients after 90 consecutive days per calendar year in a hospital or 100 consecutive days per calendar year in skilled nursing. Okay. So in this slide, we're going to look at the difference between supplement plans and Advantage plans. I would just start off by saying that what you choose is a personal choice, and it's based on your financial and your medical needs. In the end, it's just important that you choose one or the other, as not choosing a Part C plan could result in very high out-of-pocket costs to you for your uncovered care. And the reason for that is that there is no maximum out-of-pocket protection for Parts A and B. So if you were to end up in the hospital and you had to pay your portion of that care and you didn't have a Part C plan to protect you, your out-of-pocket costs could be very high. So starting out at the top, let's talk about the basic concept of each. So a supplement plan works in that it usually has a higher monthly premium, but when you go to use the plan, your out-of-pocket costs are generally lower. In addition, supplement members have more freedom to see the provider of their choice. However, they don't come with added perks like dental coverage, vision coverage, hearing aids, free sneakers, etc. The basic concept of an Advantage plan is that it will likely have a lower premium than the supplement plan, and sometimes that premium can be as low as $0 a month. But when you go to use the plan, you do have higher out-of-pocket costs. So basically, with Advantage plans, the lower the premium, the higher the costs when you go to use the plan. Generally, Advantage members do have a smaller network, so less freedom on where they can go for their non-emergency care. However, Advantage plans do come with those added perks, like I was saying a couple of minutes ago, the dental, the vision, the hearing aids, and so on. In terms of the non-emergency network, as I mentioned, supplement plans give you much more freedom. They allow members to see any Medicare provider in the US without a referral, whereas Advantage plans do require members to remain within a network for their non-emergency care. So when you're choosing an Advantage plan, it's really important for you to check before you enroll to make sure that your plan contracts with your doctors, your hospitals, and your pharmacies. Both Supplement and Advantage provide worldwide emergency coverage, so no worries about that on either plan. Supplement plans do not require members to obtain insurance referrals from their PCP when they want to see a specialist. Alternatively, most Advantage plans do require those referrals, although it does depend on the carrier. Supplement plans are portable, meaning that members can move anywhere within the 50 contiguous states and they can keep their supplement plan. Advantage plans, however, are not portable. When the members move out of the region or the state, they're most likely going to have to cancel that plan and purchase coverage in their new region. The Part A deductible, which I had mentioned earlier, was $1,600 in 2023, is usually covered by both the supplement and the Advantage plan. The Part B deductible, which is $226 in 2023, is not covered by the supplement plan. That is your out-of-pocket responsibility. However, it's usually covered by the Advantage plan. One of the great features of supplement plans is that even though you have to pay that $226 deductible, once that deductible is satisfied, there's no copays. The member is covered in full for their covered care for the rest of the calendar year. On Advantage plans, however, although there's no deductible, you pretty much have copays on almost all of your services. And remember, the lower the premium of the Advantage plan, the higher the copays are going to be. By law, the supplement plan does not come with drug coverage built in. It needs to be purchased separately as a Part D drug plan, which we're going to review in a minute. However, Advantage plans can come with or without drug coverage built in. As I mentioned earlier, supplement plans don't come with the perks or the bells and whistles, other than possibly a fitness reimbursement. However, those Advantage plans usually come with all kinds of perks. And again, that's the dental, the vision, the hearing aids. Keep in mind that the more perks an Advantage plan has, the higher the premium is going to be. And then down at the bottom here, this is specific to Massachusetts, but this is the average monthly premium for a supplement plan in Massachusetts. Runs between $115 to $200 a month, depending on if the Part A deductible is covered. And most supplement plans are similarly priced from carrier to carrier, as they all have the same network, which is any Medicare provider in the country, and they all cover the same exact services. Going over to Advantage plans, that average monthly premium is going to be anywhere between $0 and $200. And again, the lower the premium, the higher the copays, and the less perks that are built in. So here's an illustration of a sample supplement plan alongside a sample Medicare Advantage plan. These are real plans, but again, these are just an illustration. In the interest of time, I'm not going to go through this line by line, but again, you can see that the supplement plan has a higher premium, but once you pay that $226 deductible, you are covered in full with no copays for all of your services. And again, the supplement plan lets you see any Medicare provider in the US without a referral, whereas the Advantage plan does require you to remain in that network for non-emergencies. And then you can see with the Advantage plan, you've got copays for all of your services.
Sure, I got one coming in. Does exception for enrollment include spouse of employee working past age 65? That's a great question. That's one we see all the time. And for that one, as long as you are covered under your spouse's plan and it's a qualified plan, which essentially is if it has 20 or more folks on the health insurance plan, then that is an exception where you do not have to sign up for Medicare. So as long as you're one of the spouses is working and there's a qualified group plan, you can certainly wait until both of you are off the plan as far as when somebody retires.
Okay, and moving on to Part D. So Part D is prescription drug coverage. And just a reminder that Advantage plans normally come with drug plans built in. So the folks that usually need a Part D drug plan are going to be those who chose a supplement plan where there is no drug coverage built in. Part D is offered by a private carrier, and each state in the country offers about 40 drug plans to its residents from about 12 different carriers. It is very important to choose the right drug plan to help keep your out-of-pocket costs down. Choosing the right plan is going to be based on both the medications that you're taking and your pharmacy of preference. This is something that I help my clients with, is to choose a drug plan, the one that's best for them. However, there is a tool on Medicare.gov that also assists you with choosing the right drug plan. Some folks will say to me, well, I'm not on any prescriptions right now, so I don't need a Part D plan. Keep in mind that if you don't sign up for a drug plan within 63 days of ending your enrollment in other drug coverage, for instance, employer drug coverage, Medicare will assess a lifelong late enrollment penalty. In 2023, the penalty is 33 cents for every month without credible coverage back to your 65th birthday. So I always recommend folks that are not taking any prescription medications to just enroll in the least expensive drug plan available, which this year in 2023 is about $5 per month, just to protect them from the penalty and so they have some kind of coverage were they to be prescribed a medication in the middle of the year. So drug plans come in all shapes and sizes. Some have deductibles, some don't. In 2023, the maximum deductible that a drug plan can have is $505 for the calendar year. However, deductibles on drug plans only apply to name brand medications, so you don't have to meet that $505 deductible on generics. Drug plans also assess a copay for your medication. Members are permitted to go to any pharmacy in the US that accepts Part D, but plans will also offer members a discounted copay if they go to one of the preferred pharmacies that are designated by that drug carrier. Sometimes copays will be as low as $0 for a generic medication at a preferred pharmacy. Additionally, drug plans also offer mail order as an option. In 2023, drug plans range in premium from $5 to $130 a month. And again, because of such a wide range of premium, it's really important to choose the drug plan that is the best fit for you based on your medications in your pharmacy. So Part D plans also assess additional premium to those with higher incomes. If you recall from the Part B premium slide that we talked about, this is called IRMA, income related adjustment. Just like the Part B premium calculation, CMS is looking at your tax return from 2 years prior. In 2023, that adjustment can be as high as $76.40 a month for the highest earners. However, those in the base brackets don't pay an adjustment. They just pay for their Part D monthly premium.
Awesome. I think, Nicole, while you're moving on, I see a handful of questions coming in that are very they're great questions. So one of them was, does COBRA continuous coverage count as coverage by Part D? So if you're over 65 or older, COBRA does not serve as a primary insurance coverage. So if you're, let's say, if you stop working and you're 65 and you go on COBRA, that does not count as as far as covered under a qualified plan. So you want to make sure that you enroll in Medicare at that point. How much? Another question we got: how much would a drug plan cost on a supplemental plan? That realistically depends on the type of plan that you receive. So with Medicare and the Part D drug coverage, there's different tiers of medication. So depending on the medication you're on and the supplemental plan you choose, that's what ultimately would dictate the cost of the drug plan.
Okay, so here's an illustration of a sample Part D plan. This particular plan has a monthly premium of $30. And then again, they've got that $505 deductible, but again, it only applies to name brand medications. Then the member pays a copay based on the tier of their medication. And you can see that if they fill their prescription at a preferred pharmacy, the copay is lower. And again, it can be as low as $0 for tier 1 generic at a preferred pharmacy. All right, so I think this is our last slide. So just some rules to be aware of in regard to Medicare. First, you cannot be contributing to a health savings account, also known as an HSA, if you're enrolled in Medicare. This is an IRS rule. Keep in mind that this rule does not apply to FSAs or flexible spending accounts. It's just HSAs. So again, you can't contribute to an HSA if you're enrolled in Medicare. Additionally, if we look at bullet point number 2, you can't delay your enrollment in Medicare so that you can continue to make HSA contributions, because Medicare actually backdates your Part A enrollment by up to 6 months. So say, for instance, you turn 65 in March of 2023 and you're still working and you don't plan to retire until, say, December of 2023. And you keep contributing money into your HSA for the rest of 2023 in order to grow your balance. When you do go to sign up for Part A in January of 2024, Medicare is going to retro the effective date of your Part A coverage back to July of 2023. If you were to be audited by the IRS, they would require you to pay back the taxes on any HSA contributions that you made between July and January. So I always recommend that if you're approaching age 65 and considering retirement, try to make a conscious effort to stop all HSA contributions 6 months before your retirement date. And by the way, that's both employee contributions as well as employer contributions to the HSA. Another note regarding HSAs is you can use the funds in your HSA for your Part B, Medicare Advantage, and Part D premiums tax-free. You cannot use the funds in your HSA to pay for supplement plan premiums at this time. And then, of course, you can also use your HSA funds to pay for your Medicare copays and deductibles, as well as your qualified dental and vision expenses. And now, bullet number 3, there's a not so well-known rule out there for those that are approaching retirement that I think people need to really be aware of. It's called the 8-month late entrant rule. And it states that if you don't enroll in Medicare within 8 months of retiring, you will be assessed a lifelong Part B late entrant penalty. In 2023, that penalty can be as high as $68 a month, and it does increase annually as your Part B premiums increase. So I just want to repeat that one more time. If you don't enroll in Medicare within 8 months of retiring, you will receive a lifelong late enrollment penalty. And that's all we have for today. So before we open it up to questions, I just want to thank everyone for their time. We hope this session was educational. I do apologize about the delay on the slides advancing. Also, please make a note of our contact information and feel free to reach out to Ara and I at any time with questions. But now I think we'll just check the Q&A, Ara, and see if we can help with any questions.
Yeah, absolutely. And again, thank you all, everyone, for joining. For those of you that are part of a retirement plan that Sentinel works on, when you log on to your retirement account, right on the top corner, it'll say Meet My Planner. And that will show you who the financial planner that works on your retirement plan, and all of us can be very helpful as far as Social Security or Medicare goes. So I know I've been answering a lot of these questions throughout the session, and so I'll jump into a handful of them here. So a few of these we certainly covered, but they're great questions. If an employer has less than 20 employees, do I need to sign up for Medicare?
So that is carrier dependent. I gave an example in the slide that if it's Massachusetts and it's Blue Cross Blue Shield, yes, Blue Cross does require that happens. If it's a different carrier, it's likely that you don't have to.
A few of them. So I have one coming in very similar. If you wait to enroll until age 67, are you still working for an employer with more than 20 employees and have insurance? Do you have to wait general enrollment period to sign up for Part A? So I would say, again, as long as you're working covered under an employer plan, you do not need to sign up for Medicare. And then this kind of goes right in line with another question that we received. It's saying, would it hurt me if I signed up for Medicare if I'm working past age 65? So just know that it's not like you're gonna, if you're, let's say 65 working, covered under an employer plan, and you sign up for Medicare, it's not like you'll get the benefit of having 100% insurance coverage for both. Your working one or your employer one will still count as a primary insurance, but now you'll be paying for Medicare as well. So I would say if you're covered under an employer plan and the benefits of that are, you're obviously using the benefits of it, then I would most likely hold off on signing up for Medicare to avoid paying excess premiums. The only time, or I shouldn't say the only time, a very rare handful of exceptions would be, let's say you're covered under an employer plan, but you really don't like the coverage, and it's a very poor health insurance plan. Then at that point, you may consider, I guess, looking at what Medicare would provide you and the different costs there. So you could do a cost comparison there, but just know that it's not like if you sign up for Medicare and you're covered under an employer plan, you're going to get 100% coverage for both things.
Can I piggyback off of that? I would recommend, though, that you consider signing up for Part A. Part A has no premium, and it's going to help in the form of secondary coverage if you were to get admitted into the hospital inpatient. So like I said in that slide where we were going through the differences, just don't sign up for Part B if you're still on your employer's coverage, because 99% of the time, the benefits do not justify the monthly premium, and you're on the hook for that premium because your employer can't help you with that premium. So okay to sign up for a Part A, think twice about signing up for Part B because it's likely not worth it.
Another question here is, if you're no longer working, you're over age 65, but your spouse is working and you're both covered under that employer plan, do you need to sign up for Medicare age 65?
Yeah, so again, that's going to depend on the size of your spouse's group. If you're eligible for your spouse's group coverage, you can stay on that group coverage. If the spouse's employer is over 20, you don't have to worry about it. You can just be on there. If they're under 20, again, it's going to depend on the carrier and if they require you to go out into Medicare.
Sure, and I would say just to add one quick area there, it's a planning tool that I use for a lot of my clients that I work with in retirement. So a lot of it could also do with some holistic planning. So if you have a spouse that's looking to retire right at age 65, yet they have their spouse is covered under your plan as well. So you have let's just say a 63-year-old spouse, the primary one that you're using the health insurance coverage is 65 and they're looking to retire that year. A planning tool that you can kind of utilize is by maybe even delaying retirement for a few years, because just know if that person at age 65 stops working and the group employer plan goes away because they jump on Medicare, their spouse who is not 65 yet and not Medicare eligible, they'll have to pay for health insurance out of their own pocket. So sometimes delaying retirement maybe by a year or two until the younger spouse becomes Medicare eligible would most likely be wise to do, again, depending on everybody's situation. A handful. So we certainly have a lot of questions here, which is great. We'll certainly answer a few more right now, but just know that we'll certainly follow up with everyone if we don't get to you by today. But by the session, we have a 1 o'clock stop. So, but just know that we'll certainly address everybody's questions. So Nicole, here's one for you. Do the lifelong penalties for late application for enrollment in the supplemental plans apply if you retire as early as age 62?
So if you read, no, it doesn't. What you have to, you're going to have to figure out what you're doing for coverage from age 62 to 65. Let's say, for instance, you're on COBRA during that period. No, when you first turn 65, as long as you enroll during your initial enrollment period, there's no penalty for that. So
a question that we've addressed earlier on Social Security, can you collect based on your ex-spouse's Social Security benefit amount? You certainly can collect on your ex-spouse's benefit amount. You just have to make sure that you were married for 10 years, you no longer you did not remarry, and you've been divorced for at least 2 years. So as long as you hit those criteria, you'll certainly be able to collect under the higher spouse's benefit. Another question here is, would your Social Security benefit at any point, if you collect before full retirement age, not be reduced by still working? So unfortunately, anytime you're collecting your full retirement age and working, the Social Security benefit will be reduced. $2 for every $1 you receive, and then $3 for every $1 your full retirement age. So if you're working and you don't necessarily need the Social Security benefit at that particular time, I would say delaying it most likely makes the most sense. I always hate for folks to get a reduction in benefit, unless, again, of course, your situation calls that you absolutely do need to collect Social Security early on because of financial situations. One question here is, when do I need to reach out to the Social Security office to sign up for Medicare and or to defer taking payments from Social Security? So I would say both pieces, I would say kind of give it yourself a few months. So for the Medicare portion, if I know I'm retiring in, let's say, end of this year, most likely I like to give myself plenty of time, maybe around August, September, October. I'll start exploring with the Medicare office what supplemental plans I'll need, that I'm going to be signing up for at the end of the year. What you don't want to happen is you retire on Thursday and you decide that on Tuesday. So you want to make sure you give yourself plenty of time. As you can imagine, sometimes working with the government will be time consuming, and you want to definitely give yourself plenty of leeway for questions and obviously for forms to get signed and everything submitted. And in regarding Social Security, this is another kind of a little bit of a misconception. Medicare and Social Security certainly do work together at times, but they're completely separate. So what I mean by that is you can collect Social Security earlier or later than you're doing Medicare. And you can be on Medicare and delaying your Social Security benefit. So the two kind of do work together at times, but kind of know that it's not like you sign up for Medicare and automatically sign up for Social Security because you have to. You can certainly give yourself a little bit more room on the planning side there. I think we're coming up on the hour here. So I see Kendall just joined us again, and I'm sure we'll be able to get a lot of these questions answered over the next couple of days. And at the same time, I would certainly encourage you to reach out to the financial planner on your retirement plan. Again, that's that Meet My Planner feature right when you're logging in if you don't know who the financial planner is. And if anybody else has any questions, absolutely feel free to reach out to Nicole or myself.